Can I start with declarations of interest, please? Councillor Bennett.
Chairman, I'm a member of the shadow governing body of the Royal Cornwall Hospitals Trust.
Thank you. Councillor
Chairman, I declare a minor interest in item 9, fees and charges. My wife is a tutor at the Learning College.
Thank you. Anybody else? Councillor Peacock.
I declare a minor interest on the fees for lifelong learning. My daughter-in-law works there.
Thank you. And I should mention that I myself sit as a representative for the Council and the Cornwall Partnership Trust. Can we move to minutes of the previous meeting, please? Pages 1 to 6.
I have read these, Chairman, and I propose that they are correct record of the last meeting.
Thank you, Councillor Bilsbury. Is there a seconder? Thank you, Councillor Mumford. Can we have a vote on that, please? Is everyone agreed that they're a correct record? Thank you, those minutes are agreed. Moving on, item 3, urgent items. There are no extra urgent items beyond the urgent items that we are discussing this morning. Thank you. Can we move to part 1, reports requiring a decision? Number 4, review of actions emanating from the previous minutes, pages 7 to 8, report of the Senior Officer Health and Wellbeing, please.
Sorry, Chair, can I... Councillor Sims has obviously just joined us.
I have no interest to declare.
Shall I proceed with item 4?
Please.
Many of the topics which were discussed at the last meeting of this committee are on the agenda today. Some of the areas that members discussed last time included budget monitoring and Park House, and they're obviously featuring prominently in the agenda. The departmental update picks up on many of the other activities which members have agreed to, and a narrative is provided on progress. And there is also a couple of reports in part 1 and also part 3 around housing. And at the last meeting we touched upon impending legislation, and I think Diana's report picks up on that towards the end of this agenda.
Thank you. Is everyone happy that we note how the recommendations and requests from the last meeting have been implemented? Has anyone any concerns about that recommendation? Then that recommendation is passed. Thank you. Moving to item 5, future models of elder care for the islands, pages 9 to 14, the report of the Senior Officer Adult Care, Gareth Peters. Thank you, Gareth.
Thank you. Good morning. I just want to begin the meeting just by praising the staff team at Park House and in the community services, including health colleagues, GPs, for running an exceptional service at Park House. They do a fantastic job. Park House is a good rating, good CQC rating. That's required a huge amount of time and resource from services, the staff and the health and care teams. It's a vulnerable service. It's a vulnerable service because of the difficulties of staffing this service. It's a difficult service to run because of the very tight regulatory requirements in order to make it safe, which it is, and it continues to be so. The building itself, Park House building, is not fit for purpose. It's required a huge level of investment to make it safe. It's got no gardens. It's got no decent social space, and it's also a restrictive environment to work in. So I just wanted to kind of bring some context to the paper today. I don't want to go on too much. I think it's important that members have a chance to kind of talk this through, but it's a national issue that we're looking at now. It's not just for the islands. The future of elder care, the models that are provided, it's an issue that all councils across the country are working with, not in isolation. It's a decision that we need to explore with the system. So that's the health partners, with the GPs, with the hospital. We don't work in isolation. Over the next 20 years, the over 80, so the people over the age of 80 on the island are expected to double. So we need to plan for the future. There is going to be increasing demand on the service. The provision of care for the older people of the community is expensive. It will continue to be so. It's difficult to find a way around that. So the demand on the budgets will continue to be high. What the officers were looking for is some strategic direction. So today what we're doing is submitting some ideas. We're not asking today for Park House to be closed. I just want to be very clear about that. That's not a request from today. What we're proposing is that we look at the options. And we need to look at all those options. The Park House is a fantastic environment. Residential care is essential, whether it's here or somewhere else. It doesn't stand alone. It's really important to say that it's not just Park House. Park House exists within the wider system, so any decision around Park House will have an implication for the hospital, for example, for how the hospital operates, how the community works, so that people are safe in the community. There's lots of things we need to think about. Okay. Regardless of what we do, we must continue to work with our health partners. We cannot work in isolation. So there's a variety of projects with health partners. It's really important, I think, those continue. We do not stand alone. And we also, it's very, very important that we engage fully with the community. This isn't a decision, it's not my decision, it's not our team's decision, it's not just a member's decision, it's a community decision. This has a huge impact for everybody today. So I'm sure everyone will have read the paper. You've seen the proposals, so I'm happy to hand over for you to ask questions and to debate.
Chairman.
Councillor Bilsbury.
Yes, Chairman. I know we have a monumental task before us in sorting out the care of the elderly, and we have the problems of Park House building, etc., etc. But I am given to understand that the Council of the Isles of Scilly, I may be wrong, is the only local authority in the country which provides residential care services for older adults. However, the islands have an increasing number of elderly people who are liable to require some kind of care assistance to maintain a reasonable quality of life. Now, at the moment, these needs can usually be met by providing care for people in their own homes or residential care in Park House. It has been suggested that people with dementia could be better cared for on the mainland if they are unable to recognise their surroundings or relatives. However, there would be relatives and friends who wish to visit their loved ones. This could be an expensive exercise, especially if the mainland care homes were some distance from Penzance. There can also be delays due to the weather affecting air travel in the winter. It should also be borne in mind that some of these relatives and friends may themselves be frail. In addition to dementia cases, there are people who become increasingly frail with age and consequently will require more assistance than could be provided by friends or community carers. It would be inhumane, indeed I would say uncivilized, to leave these individuals with no alternative but to be shipped out to the mainland. However, I do agree that Park House is not ideal and that an alternative location on the islands for residential care is desirable. There is also the problem that it is impossible to provide adequate care in the home for the off-islands. This has been tried and it's extremely difficult to do it. It has been said that a measure of civilization is how it treats its weakest members. I believe we should always bear this in mind when making decisions which affect people. I therefore propose, Madam Chairman, that removing all residential care facilities from the islands is not an option to be considered. We can't have it yes, we'll look at closing down Park House and not replacing it. I do not think that's acceptable, and I'm proposing formally that removing all residential care from the islands is not an option to be considered, and I hope that is seconded.
Thank you, Councillor Bilsbury. You've made a proposal, and obviously in a moment I shall seek a seconder. But I would also ask you that you allow your colleagues time to debate this issue before we proceed to vote on your proposal. Would that be acceptable to you?
Chairman, I would expect no less. I would expect my colleagues to debate it and all have their say, and then we take a vote at the end of it. And I am going to ask for a recorded vote.
Would you like to seek a seconder for your proposal now or when we have finished the debate?
Chairman, could I just ask for a note of clarification before you do that?
Yes.
Is Councillor Bilsborough just asking for his recommendation to be added to the list of options?
Yes.
It's not to replace them.
All I'm saying is that we should not even consider an option of not providing any residential care on the islands. I do not think it is on. But it is not even worth considering.
No, I just want to be quite sure that all you're doing is adding an extra option to the options appraisal. Is that the case?
With respect, Chairman, as the proposal has been read from Councillor Bilsborough, I myself would interpret that as actually closing a door on exploring an area of the options analysis, which actually I myself think at this moment in time would be a little...
No, well, that's why I want us to be quite clear on, before anybody seconds it, what they're actually seconding, that's all. Chairman,
I am adding an amendment to be considered, is that whatever else we discuss, an option is not to remove all residential care from the islands. Let's not play with words. It's quite clear what I'm saying, Chairman.
Right, I think we understand that, Councillor Bilsborough. Would you like to seek a seconder for your proposal now, or would you like to wait till the end of the debate? I shall leave you to choose.
Well, thank you, Chairman. That is up to members. We can either start the debate, or I hope there'll be a seconder. Thank you, Chairman.
In that event, I think it would be clearer if I asked for a seconder for Councillor Bilsborough's proposal, with the proviso that that proposal, subject to his agreement and the agreement of his seconder, rests on the table until we have finished the debate. I'm sorry, Chairman, would you like to intervene?
I think you just have to wait and see if somebody's going to second it. I don't think...
Fair enough. Right. Councillor Bilsborough has read out his proposal. Yes, of course.
Hello, just a couple of points of clarity to aid your debate. Firstly, we're not the only local authority to provide Council 1 care homes. We're one of the very few, and obviously the only local authority where 100% of care services, apart from one tiny micro provider, are provided by the council. And the second paragraph, it's been suggested that people with dementia could be better cared for on the mainland. I just want to clarify that that's never been a piece of advice provided by officers.
Thank you. Right, to continue, Councillor Bilsborough has made a proposal. Would any member like at this moment in time to second it?
I'm quite happy to second it on the basis that we stick to all residential care, i.e. there will be no more residential care on the Isles of Scilly. I don't think anybody's ever discussed that, and I would quite happily second it on the basis that, no, we will never hive all residential adult social care to the mainland. So I would second it, provided we stick with the all.
Right, we now have a proposal and a seconder. Would you both be prepared to leave this till the end of the debate, or would you like it to go to the vote now?
Chairman, I think we ought to at least have a debate on the subject. It's been proposed and seconded. Before we take a vote, I think it's only reasonable that members, if they have any contribution to make, to say so now. When the members have all given their views, we shall then take a vote. And I'm proposing now that it be a recorded vote by roll call.
Right, well, I'll deal with that request just prior to taking your proposal, if that is agreeable. Thank you. Shall we continue with the debate then?
I may continue.
Councillor Daly.
Thank you. Chairman, this is obviously a matter that's raised considerable anxiety in the community, quite rightly. I've had letters, which is fairly rare for any council business, and I have considerable personal experiences over the last decade of the matters in this under debate. So I'd like to just start with a brief overview of services to the elderly happening at a time of low government finance. So there's no way out, we can just spend our way out. We started this idea with improved services to help people stay in their own home, and I think that's desirable for all of us, including the person involved, and as a bonus it is somewhat cheaper. The services we've provided are, for instance, the buzzer bus to reduce social isolation, because loneliness is a factor we have to keep in mind, and the off-island rubbish collection, which has made it much more possible for older people to stay in their own homes, and I must say has been amazingly widely welcomed by the residents. The hope that this would reduce the need entirely for Park House, or even to a low value, has not been realised, and that's because people are living longer and have poor health, both physical and mental, and particularly with the mental, with the dementia. The increased healthcare at Park House has put the price up. We can't just run it as a care home. It does need medical interventions. So we need to change. Change is easy to ignore and hope it'll go away, but this will make the change later even more traumatic. There is a proposal to build facilities near the hospital, and that sounds a good solution. Whether we would then keep Park House as well or not is a matter for the finances and the general sense of doing that. We may have to sell it, if it is ours, to fund the building of a facility near the hospital. I don't know whether it is ours, presumably you'll tell me later on. And the other thing that we've really got to make an effort on is housing for care workers. Lots of times we've had people come and hopes have been raised, not only on St Mary's but on the off islands as well, or hopefully a present resident can take on the job. So we do need accommodation for care workers, not only for the facility which we intend to use in the future, but also for roving care work to help people stay in their own home. So those are the things that I think are important. And I entirely agree with Councillor Billsborough. I think it would be a sentence of death to send someone to the mainland, because I've spent some time in hospital, and being there without visitors for only 7 weeks was long enough for me. I was ready to lose the will to live, and so I've got no problems with that. We have to keep our people here as long as we can, so that they can be visited and supported. So that's my overview on it. As far as the suggestions, the proposals put forward, option 1, do nothing. Well, I've already said we can't do that. We do need to change. And the development of a co-located hospital and nursing dementia unit at the hospital site sounds a really good idea to me. I think I'd like to see that pursued as far as we can. Obviously, as usual, sitting next to this lady, funding is going to be important. We've got to get the funding right. Whether there's any grants available or that sort of thing, or money from the NHS, I don't know, but we will need to include that in our investigations. But I suggest we do that. And whatever the future holds, we need to, if we're building somewhere new, we need to build in a residential facility for care workers, I think, so that we've got somewhere we can house care workers at a reasonable money, because their pay is very low. The chances of them buying a house, like a doctor might or something, is completely out of consideration. And I'm quite happy with 4.3. We'll need to, when we do all this, we're going to have to carefully consider the transition phase. People will not, you can't just sort of dump them in the corner until we've got the whole thing worked out. There has to be a transition plan worked out at the same time. I'm saying this because I'm sure the officers are fully aware of it, but I think it's something that needs to be said in the public sphere so that people understand that there is no intention of this committee or this council to abandon their older people. Thank you.
Thank you very much, Councillor Daly. I think that was very useful. Chairman.
Yes, thank you, Chairman. We have a very long and venerable tradition in the islands since the days, well, since the 1830s, so the days of the select vestry, of looking after the needs of the poor and the infirm, as it was in those days. I wouldn't like us to lose sight of that primary function of our authority, or I consider it to be a primary function. I think we need to consider all the options, the fullest possible options appraisal. It is quite clear that Park House has become unfit for purpose. It's costly, it's unsafe, it doesn't do our residents justice in any way, shape or form as it is. And that is despite the wonderful care they receive from people. But the fabric of the building is not up to purpose anymore. We do need to explore whether we can build another location. We shouldn't be tied to Park House. It's only been there since the 70s. It's not as though it's an institution, that a building that's been with us forever and ever. I wouldn't like us to go back to the days of the Rookery, however. We need to see if we can work with partners, what can be done with the hospital, what can't be done. But our first thoughts must be with the elderly of the islands and the future elderly of the islands. We need to build for the long term, not just structures, but also an organisational structure has to be built for the long term. So please let us consider all the options. Let's not narrow our focus too soon.
Thank you. Councillor Peacock.
Yes, on option 2, to explore the development of somewhere at the hospital, I notice on 3.4 that from the 1st of April there will be a consortium that will have responsibility for the hospital and the community nursing team. So even if we went for option 2 and this consortium decided it wasn't right for us to build, have we got any assurances from them that we can go forward with option 2?
Perhaps Ashley might like to answer that, but I would say I think that is exactly why we should be looking at all the options, having a full options appraisal and waiting until after April the 1st so that we can fully liaise with our new providers, our new service providers, and all the stakeholders, including, of course, members of the public. Community, I should say, members of our community. Ashley.
All the conversations with the current provider and the commissioners have been really positive about understanding it requires a whole system change. So we are in a good place. There are no commitments from anybody that this is exactly what we're going to do, because that's the point. We're at that point of discussion. All we're asking for today is an options analysis to look at everything which is safe and legal and sensible. And I think the best kind of options analysis, push the boundaries a bit and look at scenarios which we probably wouldn't want to pursue. Now, from an officer point of view, we have our own opinions about what we'd like to see, and that's why we've been going along with this hospital project. I think the biggest gap we have on the islands is nursing care. We have no nursing beds currently. We know what we'd like to see, but we need your strategic buy-in about what the future direction is. We're at a really good tipping point now where we do have, strategically, things are aligned with our health partners, with the third sector. We've got a really good Age UK presence now. But what do we want for the future? Now, as you know, Park House is a really good facility, but as you know, there's very few people there, and sometimes the investment in Park House means that we can't deliver care to the off-islands and the community as we would like. So are there ways of managing to do all the things we want to do and better? Driving all of this for myself and Gareth is the best interest of our client group, and that's people who live in Park House, people in the community, all the people, everybody around this room who's going to be old one day. And so this is now, we've got to get it right. We've got to kind of, can't stick to what we always used to do. We've got to can't do things emotionally. As you know, we registered Park House for dementia care because we wanted to bring some people back from the mainland. Now that's emotionally the right and kind thing to do, but that did have knock-on implications then for the quality of care in Park House for people without dementia. So we've just got to think through everything we do. We've got to think about the impact that doing something in adult social care will have on the hospital. Now, as a team, you know, we've got some really good friends here that we're working with constantly, with Anita and Gareth, and the efforts, and Jane over there, the efforts that people make here to keep people on the islands is enormous. And that is our driving force. But as you know, we live on an island. There are some things we don't provide. We don't provide education for children over 16. We have people who are placed on the mainland for all sorts of various reasons because that's in their best interest. We can never say we will never place on the mainland. We are never sending anyone anywhere. If people have a placement on the mainland, that's done with lots and lots and lots of conversations with the family and that individual. But we can't say never, because if you tie us to that, you're going to be providing unsafe levels of care. Some people have to go to hospital on the mainland. The hospital here will do its very best. The GPs here will do their very best to provide palliative care, end-of-life care. But we can't say never about things because that's not actually a safe or clinically sensible thing to do. But a good options analysis will look at everything. And one of those things would be, what would it be if we didn't have residential care on the mainland? There will be a long list of cons. But you need to have that on a document so you can look back in 20 years' time and justify to your council taxpayers why you took the decision you did. And there are a lot of cons about going to the mainland, exactly as Gordon describes, but you can't take that option away when it is an option that we can actually explore as a local authority. It's not illegal, but it's probably not the right thing to do for people as you described. But we've got to put it in there and write that down in a table so that you've got that, you've got your piece of paper saying this is why we are going to spend X million on adult social care for the next 5 years.
Thank you.
Thank you, Aisling. Councillor Mumford, you haven't spoken yet. Would you like to?
Yes, I think we've got to be very careful, and I think we've got to look at every option. I agree that we can't say never go to the mainland, because there are times when people won't be able to be looked after here, but I am sure that we all want to keep the elderly here as much as possible and keep them in their own homes as much as possible. I would love to see a dementia unit built up at the hospital. I think that would be one thing that would be very good, and it would separate. I don't think having dementia people in Park House and the ordinary elderly is really a very good idea. I think we need to look at, we've also got to look at savings in other places that could also affect, like the swimming pool and the sports hall, somehow that there could be more money going into community care. And I'm sure everybody would rather stay in their own homes with help with their families and with plenty of community help as well. I know I would. And I'm sure most people who are getting on would rather stay in their own homes. I think we need to work with the hospital and the doctors very closely. I think the doctors are quite concerned about the elderly, and I'm quite sure they want to keep the elderly here as well. I think that's about it. Thank you.
Thank you. Councillor Bennett, you haven't spoken yet.
Thank you, Chairman. Because I think here we're small enough to recognise everybody as an individual, and each elderly person is an individual, and to a great degree care has been tailored often to meet their particular needs, and that is something to be rejoiced in. I think that we should start the whole debate, and there is going to be, I would trust, very wide public consultation on this issue, but I think that consultation cannot be conducted properly against a background of fear of people being sent to the mainland, fear of Park House closing. We've got to have a proper consultation that is meaningful and which will come out with good results, because both Aisling and I, and probably others here too, had the benefit of touring facilities on the mainland which indicated an excellent care on extra care housing. And yes, I know this government has done away with housing benefit for social housing and so on, which makes that proposal very much more difficult. But nevertheless, if we look at people as individuals, you can provide very high quality care. And I would agree with never say never to going to the mainland. I had the benefit, some while ago I might say, of touring care for dementia patients, which was ahead of its time and showed how an individual could have their past, their previous life, they were totally encapsulated in it, with photographs of all their family and recording everything which helped their condition. And that was on the mainland. It wouldn't have mattered if it was in, I don't know, Timbuktu, because the care provided was absolutely tailored to their needs. And when we think of visiting people, you have to again agree that for some individuals, perhaps, that visiting benefits the visitor rather than the person in care. I think rule nothing out, but make sure that we follow very good models, and good models of care do not just need money, they need the right people to provide them. So, and I think we've got plenty of right people, either in the nursing sector or the care sector or in the volunteer sector. I personally would like to alter some of these recommendations slightly. Is it a good moment to read them, do you think?
By all means.
Okay. And I would like to ask, first of all, if Gareth Peters has included an integration plan into the service level agreement with the new consortium, if that is part of the deal with them.
The new consortium, which starts on the 1st of April, they've got a 2-year contract initially with the Kerno Clinical Commissioning Group, yeah. So it's not for the council to set that service level agreement, but part of that contract is to work with partners to integrate services. So the drive very much from Kerno Clinical Commissioners is for the consortium to engage in that conversation with us.
Let's hope it's more than just engage in conversation, though. Let's hope it's to implement things on the ground. There's a second meeting of a project group that we're next Thursday with the new consortium which these proposed appraisals will feed into that. So that's okay. They will be needed to contribute to this appraisal. As I've said, this work is not a standalone piece for the council. It's very much a system review and a system redesign. It'll be a large piece of work. So one of the risks of this is that it's going to take a lot of time and some quite expert skills. So we need to think about how that's going to be done. There's quite a for the Kerno Clinical Commissioning Group. They're working in quite
financially pressured time. I think they've got to find 20 million. So we need to, whatever we're doing, whatever the provider conversation, so as the council as a provider, in conversation with the consortium, that needs to be, the project work needs to go alongside what they call the Service Sustainability and Transformation Plan, which is an NHS project. So, but I suppose in a nutshell, yes, very much so they are expected as part of their contract to undertake this work.
And do you think the timescales to enable full consultation here will fit in with that?
I think that I've suggested 4 to 6 weeks. I think that's pretty ambitious. I think it needs to be a well worked up options appraisal. There is a public consultation session planned for, I think it's the 22nd of March, when the providers and the clinical mission group will be over. So I think the consultation exercises is really key here. So we need to make sure that we create the environment and the opportunities for all of the public to contribute to this and support the decision-making process.
Thank you. Shall I tell you my amended proposals?
By all means. By all
Point of
means.
order, Chairman, if I may. We can only deal with one item at once. Mine is a proposed amendment, and standing orders, you dispose of an amendment, and then you go on to other amendments.
Fine. Shall I just ask then if anyone has anything else to contribute? I think, Chairman, you had your light on previously.
Oh, it's only a very small point, sorry.
Councillor Daly.
Chairman, first of all, I'd like to make a general remark, and then I've got a couple of queries for the staff. It's not only the council that's got to work at this. Every member of the Wesleyan public has to do it. People must integrate and gain the advantage of having wisdom and older people amongst them, and make sure that they're integrated socially. And that needs to be done by everybody. It's not a council function. I've got two particular questions. One is, I want to ask the staff if they think they've got enough resources to do this transition on their own, or would they like to employ more people? Just before you answer that one, can I just repeat my question of earlier? Who owns Park House?
The council own Park House.
Let me just jump in there, because obviously Park House is in two parts. There's the flats, which are part of the HRA, the social housing budget, and then there's Park House, the elder care facility, which again is owned by the council, but is outside of the HRA. So when we think of owning Park House, we must not forget that there are 8 residential flats attached to it that we need to deal with very sensitively.
Council.
We do.
Council.
The council, yes.
Which is useful. In terms of resourcing this, obviously we always want to minimise using external resources, but this is quite a specialist piece of work. It's quite a lot of number crunching that needs to be done, and people need to understand health finance. So, for example, if we are going to come up with a model where nursing care or high-level care placements are met by the hospital, we need to understand what would that cost a week, what would that mean in terms of staffing resource at the hospital. So it is quite specialist. So we are suggesting that we employ a consultant, and that would be funded through the Better Care Fund, which we've just been announced as 183,000 for our local authority. That needs to be approved by the Health and Wellbeing Board, but it's one of our ideas is actually to get someone who's used to doing this kind of work in other areas.
Thank you. Sorry, can I just chip in there? You're not, hopefully it won't cost the whole of the 183,000.
No, we can build it.
Chairman.
Yeah, my point before related to the only word I felt the senior officer didn't include in her speech was affordable. Anything we do has got to be affordable in the long term. We're setting this against the context of national cuts and the government clawing back money or not giving out further money, and that will be a trend whichever government is in power for the future. We had the ruckus about, I think it was South Oxfordshire the other day, cutting back on children's services. There will be a pattern across the country, and we have to fit in with this pattern. We're not exempt, much as we would like to be. We just have to see what is the best possible care we can afford in the long term.
It is difficult though, isn't it? I mean, we do have a unique situation. If you are part of an authority that closes one home, there might be another one 5 miles down the road. And obviously we don't have that kind of option. So I would say, I think I would agree with Aisling that is hopefully something we would support, having an expert opinion, having an objective analysis of how we can best fulfil everybody's needs.
Yeah, that is indeed what I would entirely endorse.
Thank you. Councillor Day.
Do you need a proposal for that?
I believe Councillor Bilsborough has already asked that his amendment be. I would be very grateful to have advice on this. I understand that...
Yes, Chairman, and what we must do, we can take one amendment at once, and therefore I hope we do this according to standing orders.
Well, yours was first, Councillor Bilsborough, so we will defer to you. And I would just like to ask first, if you would just indulge me for a moment, has everybody had a chance to have their say, if you like? Dr. Barnes, can I ask if you would like to contribute?
I wouldn't want to add really to what's been said. I mean, the preferred option is obviously in the middle, not the overseas one or the status quo, and that would be my contribution. Really.
Councillor Sims.
I just wanted to put it into context for some of us in the room who may not know. It's I think the current draw on council revenue for Park House is £463,000 per every year. Well, that was last year anyway, which is in a total 27% of council tax. So basically, it's pretty much unsustainable going forward, as is in, well, anything beyond the very sort of short, medium term.
We certainly do have cost pressures, but obviously that's why I think we need everyone seems in agreement that we're going to have a full options analysis and widen it as far as possible. Aisling, did you wish to say something?
I would just say that it is really normal for a local authority to spend the majority of its resources on adult social care.
And as we have an ageing population, I'm sure as the whole of the UK faces these kind of pressures, it's been thought that at least 40% of budgets will possibly be used. Is that not so? Could I just ask a question about housing before we just move on? Perhaps Gareth could confirm that there is still a wish to proceed whenever possible with the lifetime homes at Carn Thomas, because obviously we're looking at a whole picture. If you want to increase care at home, that is all well and good if your home is well insulated, warm, and you have the facilities at your home to be comfortable. But if you live in a granite cottage, which is poorly insulated on one of the off-islands, no disrespect to the off-islands, there's some lovely houses on the off-islands, but some of them are quite challenging if you are elderly with possibly a lung condition. So could I say that I really think we'll have to sort of proceed with this at the same time as well? Could you give us any feedback on the current situation? Yeah.
Sorry, pressing the wrong button. Obviously, you know that we're looking to clear the Carn Thomas site for housing. They will be lifetime homes. Obviously, a lot will depend on the mix of tenures that we're able to deliver, and one of the papers that we're looking at later is around the current housing policy, which I think is driving us towards for housing for sale rather than affordable homes, because there is no government funding for affordable homes. So we're going to have to look at a tenure mix and look at how we can manage that. And it may be that what we have to do is drive the planning policy as well to deliver homes that are fit for people in every stage of their life, not just the life they live at the point at which they build their house. And that involves affordable housing and private sector housing.
Thank you for that commitment. Has everybody contributed everything they would like to contribute to the debate, please?
Well, in that case, Chairman, can I just wind up before we take the vote?
Indeed, Councillor Beers.
Right, Chairman, in my proposal, I was very careful to say I propose that removing all residential care facilities from the islands is not an option to be considered. I was not talking about Park House. I know Park House ideally is not fit for purpose. All I'm saying is we do not remove all residential care from the islands. In other words, don't close Park House until we can organise some alternative residential care on the islands. I chose my phrase very carefully. What I'm trying to do is to remove all uncertainty and even fear from people's minds that we are going to take away all residential care facilities, which would mean some people going to the mainland. It's as simple as that. You know, so, and people will feel better if it's left hanging in the air now. Well, we might remove all residential facilities. People will be uncertain. I want them to be certain we are not going to consider that alternative. It leaves all the rest open. And on that score, Chairman, I shall call recorded vote.
Thank you.
Can I just clarify this recommendation? Because obviously this is a recommendation that you're going to set us off doing lots of work on, so I need to know exactly what you're saying. So the recommendation is that we do an options analysis, but we do not look at the option which is no residential or nursing care placements on them. So we would always have a level of high care level placements on them. So what's the option appraisal going to look like?
Chairman, my words, I'll repeat them now. I therefore propose that removing all residential care facilities from the islands is not an option to be considered.
So we don't put that option in the options appraisal? That's
correct. You remove all fear from people's minds. While it's there, people will be fearful. I'm not asking a lot. But of course, if you want to have that option to remove all residential care, that's up to members. And I presume this is a recommendation of council.
But the recommendation is not to consider it.
Can I just say, if the recommendation is not to consider it, then I no longer second it.
Right, because I think the consider it, because also we'll just say the whole thing about the options appraisal is, say we do decide that we'll have high care level needs placements ongoing, how many? So when you say all, like, so we're looking at 2, 3, 5, 15, 20, you know, there's lots of scales of those options, which makes options appraisal so very joyous to do. So I'm just trying to clarify exactly what my brief will be.
Chairman, I
don't mind if that isn't the agreement. I need to be clear, because at the moment I'm not clear about what we'll be asked to do, and we really need that clarity from you.
Chairman, I'll say once again, it's quite clear. I therefore propose that removing all residential care facilities from the islands is not an option to be considered. Now, there's nothing more simple than that, despite, you know, any word twisting and wriggling. It's as simple as that.
Well, I think any residential.
Pardon?
I'm sorry, Chairman. I think Councillor Billsborough's proposal is not saying what he means to say.
I think we do need a little clarity. If I could just say, my understanding is that going around the table, there has been a general feeling that we would like to have a full options analysis. However, Councillor Billsborough would like to amend this to a presumption that it is not an option to remove all residential care.
Correct. Yes.
Are you happy with that, Councillor Billsborough, as an amendment?
Yes, that's what it says. I do not support, and I hope we do not support, removing all residential care. It's not talking about Park House, all residential care. You can't say we're not going to have any, and that's what that says.
Right. In that event,
Can I just reiterate, I'm no longer seconding it if it's taken off.
I understand, Councillor Sims, you have now clarified your wishes. Would anyone else like to second Councillor Billsborough's proposal?
I'm not wanting to second at the moment, but I would like to hear Councillor Bennett's options, her alternative options, before we go to a vote.
Is that allowable? Fine. Councillor Bennett.
I was amending the recommendations that's put forward. The first one would be to support a full, wide-ranging options analysis to assist members in choosing the future strategic direction of elder care provision in the islands. And that could be of total elder care provision. The second part would be to source funding for independent, objective advice on the options. And the third would be to agree the development of a transformation plan following full consultation with the public and with all stakeholders, including the new providers, after the 1st of April 2016.
That seems very comprehensive, but I would just like to be absolutely sure we're following correct procedure. Councillor Bilsborough, there did not appear to me to be a seconder for your amendment. Would you like to formally ask your colleagues again?
Yes, Chairman. First of all, I would like to ask Councillor Sims, why did he change his mind? He seconds it, he hears the debate, and then he says he's not going to second it. Councillor Sims, I'm asking you through the chairman, why did you change your mind?
Councillor Sims.
Perhaps it's a slight misunderstanding of what your proposal was. However, as soon as you said that there would be, or Ashton pointed out that officers would not be able to look at that option, then I just think we do need to keep all options on the table.
It was in black and white before you, and then you seconded it, and then for so...
Well, forgive me, it was in black and white before you, Gordon. I didn't actually see it, but I a slight misunderstanding of it. So that's why I changed my mind.
Councillor Bills, but Councillor Sims has apologised for the misunderstanding, and I really think you should accept his apology, with respect.
I don't, Chairman. Anyway,
Your
Chairman,
opinion is valid, of course.
I take it, Chairman, that my amendment will fall, as it will, because there's no seconder. So what we are saying is there's nobody around this table who would support me saying you don't take away all residential care. I'm bitterly disappointed if that is it. I'd have thought better of my colleagues.
Councillor Bilsborough, please allow me a moment. I think you will find that your colleagues are very supportive of your point of view.
Well, they'll vote for it.
However, in these cash-strapped times, when every local authority in the country has to seriously consider how to manage its budgets, it would, I think, not paint a good picture if we did not look at every option. The officer on my right has clearly explained to you that there are absolutely many disadvantages about some courses of action. And I would hope that we would not vote on that should it be presented to us as a positive option. But at least we could have a look at it, I think. And I would ask, if we now have a seconder, for Councillor Bennett's comprehensive and, I have to say, very clearly worded analysis.
I will second those to be added to the options on the table. I think, as you say, it's very comprehensive. And
could it not replace what is here already? Because I think it's in danger of being a little bit long-winded. And Mrs. Hick was asking for clarity.
As long as it's the most comprehensive overview possible, I will support that. We do, as many of us said around the table, need the most comprehensive and objective overview possible. We owe that to our community, so I will second Councillor Mrs. Bennett.
Thank you very much. Would any colleague like Councillor Bennett to reread it, or are we all comfortable with what we are actually going to vote for?
Could I ask Councillor Bennett if she could perhaps write that out and it could be circulated to all of us?
Indeed,
I've got the gist of it, but if I could... I don't know if anybody else would like it in writing, but I
think that's a very good idea, and also we will copy it to the press as well. And any members of the community who would like it will obviously make it available as part of later on of the
well, I presume it will be in the minutes in any case.
Absolutely, absolutely. In the interim, should anyone ask. Right, Councillor Bennett's proposal, seconded by the chairman, Councillor Martin. Can we take a vote on the recommendation, please? Those in favour of Councillor Bennett's recommendation, please. 1, 2, 3, 4, 5, 6. Thank you.
Those Chairman, I abstain and could it be recorded that I abstained?
Councillor Bilsborough has a recorded abstention.
And could I ask a further question on a point of order? The chairman of the council might know, or you might know, is whatever we do today, will it be a recommendation to full council where there'll be an opportunity on the 8th of March to debate this and challenge it?
I understand that the procedure is that the recommendations that we have made will go to Health Overview and Scrutiny Committee, which is, as you know, your committee, which meets tomorrow. And after that, I would certainly expect it to go to full council for ratification. Perhaps you could enlighten us on that, Chairman.
Okay, Chairman, I'm happy at that, yeah. In other words, we can have a second bite of the cherry.
If you wish to put it like that, Councillor Bilsborough, yes.
Chairman, could I just add that, especially for the benefit of the public who've bothered to come along today, that I hope the debate has reassured them that everybody here has genuinely got the very best interests of our elderly people at heart.
Thank you very much, Councillor Bennett. And I think it's a good time to say thank you very much to everyone for giving up your time and interest in this very important debate. And we are all, I'm sure, very appreciative of that. Thank you. Moving on to item 6, the financial sustainability of Park House. Mr. Peters.
So this kind of naturally leads on to finance, doesn't it? Okay, just one correction I think it's already been picked up in item in section 1.2 when the report says it's the only known local authority provider. That's incorrect. There are others, but very few.
Thank you.
So, particularly over the last 2 years, the service has worked very, very hard to support people to remain at Park House. In fact, I don't think a single resident of Park House has had to leave the island. That's created quite a significant cost pressure for the service. It's a very small home. Most of the residential homes or nursing homes on the mainland are now probably running at about between 40 and 60 beds in order to make it a kind of a business case for it. So we before Christmas we did some work on the budgets to understand the costs of running Park House, the unit cost per bed, and the figures came out at about approximately £1,300 a week per resident. If I could draw your attention to Appendix C, there's quite a kind of a simple diagram which just maybe help explain how the council is subsidising. So there are two, in the report basically, there are two ways to support the care home. As we've all agreed, the Park House will be around for a little while longer. It's not imminently closing, so we need to sustain it, we need to maintain it while the decisions are made about the future. In order to do that, we need to start moving it to a slightly more sustainable and viable service. It's always going to cost a lot of money. It's always going to require a high level, as we've already discussed, council subsidy. But there are two things to do. One thing we can look at is income generation, and the other option is that we look at savings. So the proposals that we've put forward in terms of income, we're proposing that there is quite a large fee increase. As you can see at the moment, the fees for Park House range for permanent placement from about £550 to £650. If the unit costs of a bed are £1,300, the council's picking up the gap in that. And that's also for people who are fully self-funded. So if they have any placement is based on a financial assessment, that's a national process. The council's quite unique in the fact that it will subsidise self-funded residents by the fact that the unit cost of the bed are approximately £1,300, whereas the current fees are between £550 and £650. That's compared to mainland placements, that's actually quite cheap. So in terms of affordability, we're not suggesting that the fees go up to £1,300. because that's a huge hike. But what we need to do is probably think about somewhere in the middle, certainly to make it sustainable. There's also the Chancellor has enabled the local authorities to increase council tax by 2%, a levy to use that money to support adult social care. That would raise approximately £35,000, which is a small amount of money, but it needs to be considered. And also another option is looking at how we manage our staffing levels. The establishment is set for 3 per shift. So we could reduce it to at the moment we're running on 4. At the moment we're back on 3. We've got less residents. At the moment Park Council has got 6 residents, which is the lowest actually in my time with the council it's been. Again, for every resident that's not there's added additional cost pressure on the service. So the other option is that we maintain quite rigid staffing levels to keep down costs. That has an implication because again, if we're running on 3 staff, we need to make sure that the staff can safely care for the residents in the home. So if people do have increasing needs, then we would need to monitor that very, very carefully and review that, which we do anyway. But what we've really done, I suppose, in the last couple of years when the residents' needs have gone up is that we've adjusted our staff levels to make sure that they're cared for safely, which means not transferring people to the mainland. But what we're struggling to do is be all things to all people, and which is what we've tried very hard to do over the last couple of years. So there is a risk if we're maintaining staffing levels to 3 per shift that we won't be able to provide the level of care required for certain individuals. So if people are becoming really, really poorly, then we need to think quite carefully about that. And it might mean that people's needs are best met, not in alternative placements. That is a consequence of reducing those staffing levels. So, again, happy to answer any questions you have.
Yes, Chairman, yes. Are we being asked today to set the new fees for Park House?
I think we are, yes.
Right, well, is a point, Chairman. I appreciate, and I've read it, the cost of running a Park House, what it has cost us. Our staffing costs have been increased by having to purchase in from the mainland nursing placements, in other words, agency staff, because we can't get the people that we need to take care of higher needs. We're offering grade 2, and to be quite blunt, you are not going to get the people over here paying them grade 2 pay. Take into account the housing and all that, it is not on. Therefore, for a start, that's a disadvantage. We are not paying the market price to get the permanent care we need. But there is a further one. It's impossible to forecast the financial resources of potential patients. People with assets people who have assets of 23,000 or more have to pay the full whack, and if it gets down to 14,000, they are assisted. But there is a further point on this, is that dementia, Alzheimer's dementia, is a disease entitled to National Health Service care, and yet a vast number of cases are passed over to social services where the ability to pay is being tested. And this can, and I've done this before, it can be challenged successfully. There's not enough effort being made to point out that dementia is a disease treatable and payable for by the National Health Service. And this is often overlooked. The government said a year ago that nobody should pay more than a total of £72,000 towards their care. That was before the election. Yes. Since the election, have said this will come into force in 2020. I'll leave you to judge the sincerity of the government.
Thank you, Councillor Beales, but I think you'll find that, although it's a laudable aim, has now been deferred till 2020. Yes, and I'm sure that the funding comments that you have made should be as part of the options analysis that we have just looked at. But what I would say is we're actually dealing with a difficult situation now, and we have to decide how we're going to take this situation forward.
Absolutely right, Chairman. As you are, just one point on
well,
this.
quickly, please,
All
Councillor
right,
Bills.
we are looking at the fees because you can say that Park House is making a loss or is overspending. This applies to many other areas at the council that we're doing on waste management. We should look at the whole lot before we isolate one and say, right, we'll double the charges.
I think your point is well taken, but unfortunately we have to be prudent, and we are faced with a problem now which we have to try and resolve, albeit keeping it under constant review. Councillor Bennett.
A question, Chairman. Has any thought been given to staging these
I would hope that
increases?
somebody would have made that proposal, so if you wish to suggest that, I would find that quite helpful.
I mean, I haven't looked at the possibility. I was hoping somebody would have worked out the sort of formula, perhaps, for bringing it in more gradually rather than these wham-bam increases.
Would you like to comment?
Yeah. That can be a recommendation, and we can bring it in. It's difficult. It's. I know it's on paper it looks it's a large increase, isn't it? And if the members propose that we introduce that as a phase increase, then that can be done. Any phase increase again, I suppose, adds an additional cost pressure to the service.
Yes, I will propose that the increases are phased in. I can't suggest how, to what degree, but...
I think months.
Months, did you say?
Well, I imagine that it would be a gradual phasing, but not too gradual, in order to show a commitment to trying to balance the budget. It's a difficult decision. I do allow for that. I would also hope that we could facilitate, not pay for, but facilitate independent financial advice for residents who may need help to manage their finances, because it is a big increase. Could you confirm that that would be?
It's actually the income is a very unpredictable beast for Park House. We don't know how many people are going to be self-funders in there. It's a proportion. I think nationally it's about 40%. For us, actually, it's slightly lower than that. So it does vary. And one self-funder can bring £60,000 income, looking at a purely income position. So there's that. Just a couple of points as well. I'd like to. We should be paying our care workers lots nationally. They do an amazing job under huge pressure. It's a really challenging job, but the local authority is very, very competitive. It's generally actually, so the minimum, the living wage is coming in next year. We're already paying the living wage. It's not, so we're not, we're paying more than you would get on the mainland, but us, it's still not enough, is it, for the work they do. And on the continuing healthcare, Councillor Bills was talking about health funding. It's a route that we fully explore with all residents. It's got a complex route. We do challenge it. We do make sure that and that's been brought in. It wasn't a couple of years ago. It now is. There are residents funded. It's not specifically related to dementia. It's about an individual's need rather than dementia. So, but that funding route is applied. An important point actually legally that when somebody is health funded, the local authority should not be funding. So the 100% responsibility goes to the health service. We've had people in Park House who have been health funded, and they pay the weekly rate, which is 500 or 650 odd pounds. But the council still pays the other half of that in subsidy because of the unit cost. So in effect, the council is funding a health bed.
Councillor Mumford, I thought you had your light on.
My question's been answered, thank you.
Oh, fine. Councillor Bennett. Oh, sorry, Jen.
Oh, sorry, I would like to make the proposal that the increase in fees is staged.
Thank you. Can I just, sorry, I didn't notice the chairman's light on. Would you mind just waiting a moment while I ask her?
I think the very fact that we're talking about a 70% increase is the implicit acknowledgement, and I know it has been discussed behind the scenes, about how this is a huge hike in the cost. However, the fact remains that for very many years, the costs were too low. We do have to retrieve some of the money, so any phasing that is voted in should be in the very short term. It's a terrible situation for anybody to be in, to have a huge hike in costs. However, if we cannot fund the service, we will lose it. And we do have to consider that.
Councillor Bennett.
Chairman, I am fully aware of the threat the finances pose for the residential care. I think it may be considered reasonable for the increase to be phased in over 2 years.
Would you like to comment on that?
I'd be concerned about that length of time. I think we need a decision. What I'd be helpful for us today is to know, one, the level of fee increase to be proposed. You know, the upper limit is 70% acceptable. Are people satisfied with that, or do they want more, or do they want less? And the timescales, 2 years is a long time to put a lot of pressure, consistent pressure on the budget. So there will be quite considerable budgetary consequences of a 2-year phased increase.
I'm very aware that I shouldn't lead from the chair, but on the other hand, there is, I think, a thought that if we don't go for the fee increase, regrettable and difficult though it is, we might actually not be protecting the service that we actually want to keep. I am only pointing that out to colleagues. I really am not attempting to lead. Councillor Mumford.
Could we not make it a year, perhaps half for 6 months and then, or 6 months, after 6 months, go to full, increase by a percentage for the first 6 months, and then the next 6 months on the full. So it would be within a year we would have the full amount, or 6 months at a reduced rate, which would give people time to organise their finances.
We are in the middle of budget setting. Is there a way in which members might agree that we could have further discussion on this and bring it to full council with the rest of the...
I mean, perhaps what we could do is work those out and submit those to the relevant committee so that you can so we can understand the consequence of those measures, whether it's 50% at 6 months at 35%. We can offer a couple of options so you can see the consequences of each of those.
Chairman, I think we should be given different options to look at, and also the number of people the impact it's likely to have on the residents. I know we're not concerned with individuals, people's circumstances, but there could be an assessment of the likelihood or otherwise of losing some residents to other places. You know, I think it ought to be a fuller picture that we're given.
I mean, I think all we're going to be able to develop, Chairman, is some principles about phasing, because actually we're talking about very few people. Self-funders don't have to agree to a financial assessment. We're not going to get you to the level of detail which will show us the affordability for individual residents. There might be some discretionary conversations, which I think actually what we might come to you is a set of principles, and then you delegate us some discretion for individual cases, that our kind of people who are doing the assessments can make. Income isn't going to be what sorts this out with that number of residents, with an unpredictable level of self-funding and how not knowing how much people have got in their bank accounts and all that stuff that's incredibly confidential. So we think we need to start having the principle, because obviously in every other part of the country, if you can afford to pay, you pay, and that is in social care, so that therefore the council will subsidise those who cannot and that's what we will continue to do. But it's just that those who can afford to should be paying nearer a market rate, and we're not really charging a market rate right now. We are not going to the £1,300 a week, but you just need to know that we are subsidising, and if any of the conversations we had earlier about anything at the hospital, there would be a continued subsidy, and that's obviously got to feed into the options appraisal. You've got to know what you are paying for per person. So shall we come to you then with some broad principles about how we could phase this in? But I think we've got to do it quickly. A year is a long time, to be honest. And as you know, some local authorities have done this, some care homes have done this overnight, which is absolutely brutal and not appropriate. But we could apply it, for example, straight away for any new residents, so it will be clear when you first come, and then work out what we do for individuals.
I'm conscious Councillor Mrs Peacock's been waiting for rather a long time,
I
so
beg
I'll wait.
your pardon.
I'll wait.
That's
No, it's
all right.
fine.
I beg your pardon. Councillor Peacock.
Well, yeah, I'm going down a different route altogether, because just looking at the overall cost of running Park House is an awful lot of money. And it's just a simple question, really. I'm not querying the costs, because I think they do a good job. So it's not a criticism. But I would like to know, goods, supplies and services are £41,900. What do goods, supplies and services cost? What are they? I can understand goods and supplies, but what are the services that are included in this cost?
Could I ask Mrs Greenlaw to speak to us on that one, please?
Shall I turn my on?
So in this case, goods, supplies and services include cleaning materials, equipment, maybe bed needs to be beds, food, catering costs.
It's really important stuff.
Yeah, catering costs.
I can understand that.
We've also got some certain costs, obviously, for agency staff, and those are classed as services.
Okay, that's right, it's the agency costs.
So we have included some of those costs in the budget. And I'd also like to point out, in case anyone is unsure of the depreciation element in the 2014-15 budget, that's an accounting adjustment. And in a nutshell, it's basically us recognising the lifetime of an asset. And in the case of the 14-15 accounts, we revaluated Park House and the land underneath it, which brought out this charge, but that hasn't been built into the fees and charges that Gareth is proposing at all.
Thank you very much.
Chairman, did you want to
I'm
come back in? Or
Possibly. Of course, I forgot what I wanted to say. I would reiterate the Chair's comment regarding we need to protect the service, and which is probably why this has come to a head, and also the Chairman of the Council's comment that this very large increase is a result of just not applying fees and charges sensibly over a number of years, which seems to be an endemic problem with the council. But what I want to ask for Gareth is just some clarification. What's the impact on a current resident and somebody who's coming in after these fees and charges are applied? Is it just, because I'm not altogether clear. So a resident now would have their fees and charges, they would just go up on the 1st of April or whenever? Or, you know what I mean, is it?
Well, it says we need some recommendations around that. I mean, the proposal is really, my proposal was that we got on with it. And it is about protecting the service, that it would include the current residents. Of course, we'd need to be having conversations with those, all those family members and residents who are subjected to a consequence of this. So, and all new residents too. It is, for me, it's about sustainability. It is about how we can afford to run a residential care home or a nursing home. And just to reiterate Aisling's point, that when we go forwards, whatever that looks like, the costs are still going to be there. So it's about, this is about planning, a part of planning for the future.
The other side of it is the opportunity cost of not having this additional funding impacts elsewhere, and also impacts on other solutions for elder care in the future. So I think we need to bear that in mind. in a way, sustaining a sinking boat for a longer period is not necessarily sensible when those funds could be used more creatively and probably more sensibly and with a better care provision in the longer term.
Don't prejudge the options analysis. Chairman.
And I think we need to be quite clear that although we might be talking about 70% today, at some point in the not too distant future we might be talking about 100% that people are not subsidised at all by the council, depending on what options we take in the future. So a subsidy isn't inherent in our ongoing strategy, is what I'm saying.
Do you want to formulate that into a proposal?
Well, I think that will come into the options analysis. I don't want to prejudge what they will say, but I imagine that it isn't sustainable going on into the future to continue to subsidise. I mean, they don't on the mainland, as somebody pointed out earlier on. So that will form part of the options analysis.
I seem to be faced with varying views around the table and an acknowledgement that we do need to move forward with a fee increase. Would anyone like to propose that we make a move in the direction of travel and have some degree of fee increase within the not too far distant future in order to protect the sustainability of the service?
I'm happy to approve an increase in principle if the officers are able to fine-tune figures to the satisfaction of members with regards to phasing. I'm happy to include that in a proposition, but we do need to move on and we will need to increase the fees. And I think any phasing, as I think Mr. Peters said, should be very, very short term, otherwise the service is endangered.
I think that's very clear. That's a proposal from the chairman. Would any colleague like to second it? Councillor Bennett?
Yes, I'll second.
I would support that, Chairman, provided that in doing this, we ought to look at all the other areas of the non-frontline services where the council is forecast to be overspending. There's a whole list of which I will not go through now. I think we shouldn't just isolate Park House. We should say there are other areas which need looking at, and this may help to minimise the spending on Park House. I'm talking about non-frontline services.
Without wishing to shut you up, Gordon, we are in the process of doing that throughout the whole area of the council's expenditure.
Yes, this is what I'm saying, Chairman. Before we make a final decision, we can look at the whole thing as a package, and look at the non-essential services, which may help us in doing this.
Councillor Bilser, I would remind you that you attended a workshop last week, and I hope you will be attending the second workshop this week, precisely on the subject of this. So, as you well know, we are looking at the whole range of services provided across the council.
That is excellent, Chairman, provided we take it into account when we look at the Park House charges.
Thank you, Councillor Bilsbrook. Right, we have a proposal on the table, proposed by the chairman and seconded by Councillor Bennett. Can we take a vote, please? All those in favour? Yes, Chairman, would you like to repeat your proposal for Councillor Daly, please?
That we agree in principle to the rise in the fees, subject to the officers just working out the phasing of it in line with comments made by other members. But I'm sure it was written down more eloquently than that.
Would this then come to full council for final ratification, because it needs to be done swiftly?
Thank you, Councillor Sims. That seems a good idea. Can we take a vote on that, please? All those in favour? Thank you. Anyone against? Any abstentions? The proposal is passed. Thank you. Moving on to item 7, Community Services Service Development Plan, page 27, the report of the Senior Officer, Health and Wellbeing.
Chairman, might I suggest just a minute's comfort break for people, just so people might be able to leave the public gallery should they wish to, and
get myself ready for this.
We just pause for a minute, Joel, okay? There's a lot coming.
Hanging on my every word. I thought they'd be hanging on my every word. They won't take it.
just wait. Yeah. Is everyone happy that we recommence? Yes. Right. Joe.
Thank you, Chairman. Members will be familiar with the style and format of our service plan. It's the same format and style which has been used at previous meetings. The right-hand side of the column of the actual table offers a RAG rating, and there's also a narrative. I'm pleased to say the vast majority of the identified activity is RAG rated either green or amber. There are a couple of points which are red, which focus on issues to do with care in the community, and that sort of alludes to previous discussions we've had this morning, and also around the buzzer bus. And there's a meeting scheduled tomorrow with Age UK to highlight some of those issues, perhaps around garaging and reliability of the service. The other part of the plan really talks about some of the successes and outcomes which have been achieved over the last few months, and they link into progress for some of our staff in Park House around health and social care qualifications. Progress has been made on Section 136 mental health protocols. A new database for children and adult services is developing well and making a difference to frontline professionals and the work they're doing. Some new services have been launched within the active SILI remit around weight management, aquafit and aerobics will be starting soon. Zumba offered by an external provider has been highly successful. We've been looking at more integrated activities. There was a positive event in the town hall just a week or two ago, which had members of the Memory Cafe, Park House residents, as well as lots of children and young people participating, which proved a good model and is something which we want to do in order to promote public health of our community more in the future. Lifelong learning has seen a 44% increase in learning numbers over the past calendar year. And we've also touched upon winter wellbeing this morning around insulation. There was a winter wellbeing day held in this building in January. Over 70 members of the community were supported in that through either coming to this event, coming to this building, or through home visits, which again proved very successful. And they were promoting switching and saving, highlighting where people are paying more for their electricity use than they need to be doing so. So this report hopefully just summarises some of the activities which have been going along across the wider team and allow members to comment and challenge further if required.
Councillor Bilsbury.
Yes, Chairman, an excellent report. One small point on page 35, which is the plan. It talks about the buzzer bus, and then below that, halfway down the column on the right-hand side, it talks about support discussion on how to reduce the costs of off-island residents' access to health appointments. The national legislation states that nobody from the Isles of Scilly, I repeat, Isles of Scilly, should pay more than £5 towards the cost of attending a medical appointment on the island. That's the cost of getting there. At the moment, that they charge £5 to go on the helicopter. But this has been to the disadvantage of off-islanders who've had to pay for getting to the off-island to the point of departure at the airport. What has been looked at now, and we are telling Cairno this, that nobody on the Isles of Scilly, which includes the off-islands, will have to pay more than £5 for going for an appointment. The way it's achieved will be looked at the moment. It's in hand, and my committee is looking at this. Just for information, perhaps.
Councillor Day.
Chairman, I'd like to thank Councillor Bilsborough for his concern. But it doesn't just apply to appointments on the mainland. Sometimes it costs more than £5 to get to St Mary's for a medical appointment. Are we suggesting including that as well?
Councillor Bennett.
Chairman, this is one reason why the concessionary boat tickets did include health special boats.
Yes.
And I think that is the area we could look at for improvements to rule out any exceptional costs. When I worked for the Community Health Council, we were well aware of the of the legislation which entitled Isles of Scilly patients to go all the way to a mainland hospital at the £5 fee. In fact, because of our sense of fairness to people, for example, who lived in St Just and going to Treliske, it would cost them money. We sought parity with those people rather than book the health service for every possible penny. And yes, to get a special boat in those days, to go to St Mary's even for an appointment was very costly. But I think these steps which have been taken since those days really make us on a level, on almost level playing field with other people. And, you know, I think we've probably, when we're seeking greater assistance, we should be looking at our local schemes with the concessionary boat tickets.
Councillor Day.
It's only the people who get the concessionary boat fare who get the medical special tickets, but younger people or babies or whatever, they need the money too.
Right, so this is obviously an issue that was raised at Health and Wellbeing Board. Firstly, the council is paying for health specials, which given reducing budgets seems absolutely daft. And we set that up, remember Colin and I did this because we had a pot of money that was ring fenced for transport, so we used it. Health are looking at picking up their statutory responsibilities, which absolutely apply from cradle to grave. And that would be really sensible when we are reviewing what we're spending on concessionary fares. If we know that health will pick up their statutory obligation from going forward, what are we going to do with the remaining pot?
Shall we consider that a work in progress?
Yeah.
Thank you. Would anyone else? Councillor Mumford.
This is not on the same subject. Going back to Buzzer Bus, the garage space. Now, Buzzer Bus has been out of action 2-3 times, and having spoken to the driver, he says that if the Buzzer Bus had been in a garage, these problems wouldn't have arisen. I would like to know what is happening about getting a garage for the Buzzer Bus.
Yes, please do.
We're looking at a number of sites and there are some options, and we're looking at a potential site down on the industrial estate as well. The site that we preferred we can't use because it's proximity to the substation, so we can't build there. So what we're looking at is an alternative site on the industrial estate or an alternative site at Enna.
And how long is that going to be? Not months or years?
We're hoping not months or years.
Thank you.
Can I just say I think we should take all the steps that we can to protect an asset that is actually hugely valuable and does so much to prevent social isolation. And this seems to have been ongoing for months and months and months.
At the risk of being facetious, I take it you mean the driver. No, I'm just attempting to say thank you very much to the drivers of the service, because what they do for our community is hugely appreciated.
Above and beyond. Absolutely, thank you for that. May I ask a question about page 41? The physiotherapy is so important to people's health and well-being and keeping them mobile. Can I ask what physio? It says here the invitation to tender for the project is expected to be submitted in February 2017. Do we mean that?
No.
Good.
Typo. Do apologise. Yeah, so
well, at least it proves we read it, doesn't it?
Yes, absolutely.
Thank you. Any other questions?
In that case, I propose we note the report, Chairman.
Thank you. Are we all agreed we should note the report? Does anybody not wish to note the report? Does anybody wish to abstain? In that event, the report is noted. Thank you, Joel. Moving on to budget setting, which is in a separate report. And that is the report of the Senior Manager's Services to our community.
Okay, thank you, Chairman. You should never start reports with a mistake, but there is one on learning and library. On page 9 of the supplement, due to a manual adjustment, the actual controllable totals for 16, 17, 17, 18 aren't right. I'm going to ask my colleague Rachel to read out the accurate figures.
So you will on... Sorry,
could you just tell us what page you're on?
9.
Yeah, it's page 9 of the supplement pack 1.
I've got it. You need the... Why did you get the new one? Supplement 2. Supplement 2.
Supplement pack 2.
There you are.
Yes. Your supplement pack 2 replaces the learning and library section of your earlier supplement. Is that correct?
No. The whole thing. So that's the next agenda item. But we're just looking at agenda item 8, which is included in supplement pack 1.
Right.
Have we got right?
I think the one you've
No,
got...
that you've got the wrong piece of paper. Supplement pack 1, item 8.
In supplement pack 2?
No,
1. Sorry.
Pack 1.
Pack 1.
Get so confused.
Item 8.
Sorry, I was...
Page 9.
Yes, that's it. That's the one.
I won't ask you again.
Sorry, a bit elderly over here.
No. Sorry, there's so many supplement packs. On the learning and library budget on page 9, what we've done is we've removed a contribution from reserves to lifelong learning in future years, but the totals at the bottom of estimates 16-17 column and 17-18 column, the totals at the bottom weren't adjusted to include that. So they should actually read 160,200. And for 17-18, 164,300. We removed it because we wanted to show you the full cost of running the learning and library service and not hide any figures from you. Thank you.
Thank you.
But overall...
So that's cost to the authority of running those services?
Yes.
Okay, thank you.
Overall, you won't be surprised about the summary report on Park House, and it's something that we've discussed all year. But I think one of the contributing factors to this has been unrealistic income levels being set, and I'd like to really thank the finance team for working with our team to get a much more accurate position on what income actually is, and not using reserves to offset against services. So this gives us now an accurate reflection of the true cost of services. So we are showing an overspend within this service budget.
Councillor Peacock.
It's just a query, really. Is lifelong learning and the library all lumped together? Is it possible then to have the library separate from lifelong learning, or is that difficult?
Yeah, we could do that.
Because that would be very relevant just to see how much the library costs and how much lifelong learning.
Yes.
I've declared an interest in lifelong learning. I think we ought to leave while we discuss this.
Yes, thank you, Councillor
Yeah, my wife's a tutor there.
Yes.
So I think in fairness we say that.
Councillor Sims.
I think, to reiterate what Molly said, it would be quite useful to have that breakdown, because I'm very keen on the library, whereas I'm not very keen on lifelong learning. Bluntly.
Fine.
Can I just make a bit of a plea that when we talk about all these things, we're talking about individuals who are studying there, people who are working there. I think it's just really, really important. And when we were talking earlier, weren't we, about Park House and minimising feelings of fear, because that doesn't help any kind of sensible conversation and really, really doesn't help me do my job.
That point is well made.
Yeah,
Chairman.
and I was going to make the point that individual likes or dislikes are irrelevant. We're looking at services and service costs and how we can move forward across the authority. It will be a question of whether we have to diminish services, cut services, reduce services, share services, but it will all be done based on evidence and need, not on personal likes and dislikes.
Thank you for that clarification. I think the point is well made. Can I ask a question about adult? Oh, sorry. Would you like to come in first?
Sorry, I just wanted to partially answer Councillor Peacock's question, just to give her an understanding of the general ratio of learning and library. The library service, it usually brings in about, well, we've budgeted about £5,000 in a year for the different fees and charges that are set. And it's run on quite a small skeleton staff. And the main cost is actually a service level agreement we've got with Cornwall to send us over books. So actually, from a financial perspective, the library is run very frugally. I just wanted to point that out.
Yes, indeed, and it's of huge benefit. Yes, thank you. Can I ask a question about the adult social care budget, which is page 8? I've got two questions. Can you please clarify in a little bit more detail the premises costs? Because I understood if it was referring to the left-hand side of the Carn Thomas site, that in fact the arrangement we have with the Duchy is actually quite beneficial to us. So I thought that seemed a little bit high. And can you clarify the 15-16 transport and travelling costs of the Adult Social Care Department, which at nearly 15,000 seems awfully high again?
In terms of the premises costs, I will get back to you in case I'm wrong, but I believe that is business rates for the Carn Thomas site, mainly. There's also things like cleaning domestic supplies to clean the building. We need to keep it safe for the residents. Electricity costs.
I see. Oh, well, yes, I see, but a bit more clarification would be good, thank you.
Yep, that's
so
fine.
This was the approved budget, the nearly 15,000, the transport and travelling costs. And as you say, they haven't actually translated into actual usage. Is that what you're saying?
Absolutely.
Yes.
Obviously made huge efforts not to
I was
travel.
just rather interested in why the approved budget then was 15,000, because the actual expenditure 14-15 was 9,276. So we'd actually approved a budget increase, which appears on paper to be almost 50%.
Yeah.
So, in fact, it's more a question of there being a little bit of a problem with the forward planning rather than there being any real problem.
Absolutely.
Thank you.
Yeah.
If we just finish discussing lifelong learning, because I could get Gordon back in.
Oh, yes, would somebody like to rescue? Thank you very much, Councillor Sims. Yeah. So is everyone ready for the recommendation, which is to note the 15-16 periodic revenue budget monitoring content for information and recommend the estimated 15-16 outturn and future year budget to full council?
Propose 1 and 2.
Proposed by the Chairman and seconded by Councillor Mumford. Can we take a vote on that, please? Thank you very much. Is anybody against the recommendations? No. Would anybody like to abstain? No, the recommendations have been accepted. Thank you. Moving on, we are moving on to fees and charges for the Learning and Library and Active Silly. The report of the Senior Officer, Health and Wellbeing again, please.
Thank you, Chairman. Just so members are aware, it's supplement paper 2, which we're looking at. And many apologies for the late tabling. I think this is an amended version. And on page 1, it should have amended version in bold, red lettering up towards the top of the page. Can I assume people have got the right copy in front of them, and I'll just proceed with some narrative to support it? That's what, yeah.
A point of interest is that the size of the print on some of these is small, and I've had my eyes checked last November. I can still fly if needs be. I find extreme difficulty in reading this. It could be overcome by if you narrowed some of the columns and enlarged the font. It's not beyond the wit of man, but these are extremely hard to read easily.
Your comment is noted, Councillor Pearce.
Can I just make on this? Certainly the top of it, black on dark blue doesn't work, but I find it may help you, Gordon. I looked at this again last night, couldn't read it, so I just looked at it on the computer, and then you can zoom in, and it's a lot where you can read it then. I just couldn't read it as it was last night.
Thank you. Right. Would anyone like to comment on the paper or ask questions of the officer, please?
I'd just like to say that the fees and charges that have been brought before you, there's a considerable amount of effort that's been put in by Joel and the rest of his team to come up with some new fees and charges for health and wellbeing. We're all very aware that we've got a budgetary position where we need to potentially make savings, bring in more income. So with this particular set of fees and charges, we've focused with the team on bringing in a new structure of unlimited passes so that people can come in and use the gym and the pool and the classes whenever they want for a set fee. We are anticipating that this will provide us with a good income basis for the service so that we can predict into the future, and it will bring more participants in. The team are really geared up to promote this, and we think it will be a really good thing for the service.
Thank you.
Could I just add to that, Chairman? We are abundantly aware of the need to raise as much income as we possibly can through both the library service, but more importantly through the active silly service. And that's sort of been underpinned by our philosophy. I think we need to do far more to target particularly those who potentially could be moving towards Park House in due course. We want to create a very strong holistic service, recognising that active living and healthy living, both physically and emotionally, can delay some of those transitions. So we're very much aware of the need to produce a strong package of services, and that's going to be reflected in things like the Aquafit, which is launching very soon, but also some of the activities for children and young people to encourage healthy lifestyles from a very early age. We're very aware now of the need, and I think it's reflected in the table, to have a very clear view of what the services cost to deliver. So some quite detailed analysis has been undertaken, particularly around some of the swimming activities to make sure that the services are generating some profit. We're aware of the cost of the services, and I don't think there's any swimming pool in the country, in the world probably, which is cheap to run if we're looking at high quality provision. So we're very aware of the need to raise as much footfall through that sort of service as we possibly can. We're also looking to try and be as innovative as we can, and I think there's opportunities through hire of some of our facilities, exploring some issues around salary sacrifice that could be done better, and talking to some of our health professionals to signpost more effectively as well. There's also a strong tourism market which we can look to exploit a bit more perhaps through better promotion and marketing, again making them more aware of the opportunities to come down, particularly on a cold, wet August afternoon or something, to use some of our opportunities. So I think as we move forward, we're very keen to raise awareness of the service, both from professionals and the general public, but also visitors to Scilly. And I'll just echo the point that to achieve this, I think we need very highly motivated staff, so they can sell as best as they possibly can. So I think as long as they're getting clear messages that Chairman of the Council was alluding to, I think we stand a good chance of using our staff as really strong assets for us.
Chairman. Yes, thank you. Yes, I agree with that. In order to protect what I consider to be a wonderful resource, a community library, I would advocate that we use the building more, and that would help fund the building as well. I mean, it is a good premise, good set of premises which isn't used to its maximum capacity. So if it is at all possible to use it as a shared facility whilst respecting the library usage of it, I think we should explore that, because it would help also fund and ensure that the longevity of the service.
Good. Councillor Sims.
Well, intended outcomes 2.2, 2.3. That our facilities, particularly our swimming pool, gym and sports hall, remain vibrant and financially sustainable. I'm just looking at the figures that we were given for the budget review we did last week and coming up this week as well. How we living is cost the council 41,000, the swimming pool cost the council 76,000, and I just don't see how that fits in with vibrant and financially sustainable, and also high quality and affordable. I don't think it may well be high quality and affordable for the people who are using the facility, but I just cannot see how it's affordable for the authority.
The problem is, Councillor Sims, you can't quantify prevention, and you don't know what the use of those facilities has actually achieved in terms of people not using other facilities. It is incredibly problematic, which is why I think we're doing the budget review that we're actually doing.
Which is precisely why I made that point, really.
Yes, precisely.
You have to offset opportunity costs again.
Yeah.
I mean, certainly with respect to adult social care, which is a much, much more driving need than healthy living and the swimming pool. I don't particularly want to make these points, but I think they need to be made.
Chairman.
I don't think anybody would doubt the usefulness or the healthiness of sport and pools and things. The question is, who runs them? Who pays for them? Not the activity in itself. And I think we do need to explore options for keeping some of these facilities, but not necessarily having them run or financed by the council.
Yes. And I think what we also should do, hopefully, is look at other authorities all over the country, because there's some really innovative ways of managing resources going on out there, and sometimes when we're here, perhaps we don't always engage with that as well as we might.
Yeah. I mean, absolutely, we are already exploring. So since our conversations last week, that's why you've got a different paper. We looked at our fees and charges again. We are looking at the models of different kinds of ownership, which have been explored in the past. We have to be mindful of community capacity to run a sports hall and a swimming pool, given that we're always saying how hard it is to find volunteers and so on. It's not that straightforward. There would be some savings you might identify, because obviously local authority costs can, in terms of central services, etc., might make a difference. I think it's really, really, really important that everybody around this table, and actually all members, have visited all these services recently, particularly if you're somebody who doesn't like them, because I think you need to know exactly what it is you're discussing.
Can I just clarify that
really,
a minute?
No, it's absolutely...
I meant utility as opposed to personal dislike.
Absolutely. I think it's really, really important to know what it is we are offering and what service users are getting. And Amanda will remind you of when we changed one swimming pool lesson last year for the over 60s, and we therefore needed to have a very rapid conversation with 25 people about that. So there is an impact to everything we do. So it's just understanding that. So I would really, because I think a lot of people around the table not necessarily have recently gone to the swimming pool, and maybe it'd be good to come and observe some swimming lessons. Good to come and see some learners in lifelong learning. And I think that's our responsibility to you as officers, is to make sure our services are clear to you. You know exactly what you're paying for. So I will try and set that up as soon as possible. But I think you need to live and breathe what's going on in there and really understand lifelong learning is delivering a big chunk of statutory responsibility. You have to provide adult education. And so maybe there are other ways of doing it. And there's nothing's off the table, but just make sure you understand what it is we're currently talking about. And I think we also need a visit to Park House, but that's got to be managed properly because we don't want to be bombarding the poor residents with all of us turning up. But again, you need to see what's going on in these service areas.
Absolutely. Jim?
Just to repeat what I said earlier, I'm not decrying or devaluing or questioning the value of these services or activities themselves. It's how they're run, how they're financed. That's how what we need to be looking at, not the fact of the services themselves.
Before we take the recommendation, can I just ask for clarification that we're actually going to monitor the effect of the changes in the concessionary rate? I know they're only small, but they might impact on usage, in which case we'd be shooting ourselves in the foot, with respect.
I think that's absolutely the case. And what we want to do is present some case studies, perhaps of new users, existing users, that help tell the tale of how some of these changes have impacted upon them personally.
Thank you. Is everyone ready to take the recommendation, please, which is that members consider and approve the fees and charges for 16-17 as per the attached appendix, and that the concessionary rate is applied as noted in the recommendation.
Propose.
And seconded to Councillor Mumford, thank you. Everybody in favour of accepting that? Anyone against? Any abstentions? The recommendation is carried. Moving on to item 10, housing policy update. The report of the Senior Manager Strategic Development is on page 57.
Thank you very much. I welcomed Councillor Daly's earlier comments when we were discussing the residential care home on the need for more affordable housing for essential workers such as care workers. Unfortunately, the government policy agenda is moving away from affordable housing for rent towards private ownership. This is a particular risk on the islands where we are so much more dependent on the rented sector than we are on the home ownership sector. So we have a completely different demographic in our housing stock than you have on the mainland, where about between 60 and 70% of our stock is rented, and that's the whole